We're back and we're moving into our first conversation for this morning as we look at some of the most recent data coming out of the Ministry of Health that assesses the 2018 period. We're joined with us at this time, Surveillance Officer of the Ministry of Health, Lorna Perez. Good morning.
Good morning. Good morning to everybody.
All right, so let's just start off because I had said 2019 earlier. You clarified for me. We are looking at the data that has been confirmed for 2018, right?
Right. There is a process of validation of data. I mean, so 2019 data won't be available until probably the end of the first quarter, especially mortality data, because that has to go through a rigorous process of validation. So for right now, what we have is the 2018 data.
Okay. And how do you validate, especially cause of death?
We have to realize that the Ministry of Health is the official entity responsible for that vital statistic for deaths.
Yeah.
So we have to collect all death data from public facilities, private facilities, and even deaths that occur outside of the country that have to be brought into the country. So there is an entire process of ensuring that we are accounting for all deaths. So that requires the collection of all death certificates that have been issued out. And so there is a process that is entailed there whereby it's a triplicate. And so the institution usually stays with one, and one comes back to us, and one goes to the family. So,
yeah.
Of course, you know, this is we rely on people to return these. So when that does not happen, then we have to actively go out and seek out these certificates.
Okay.
What is the data showing insofar as perhaps the leading cause of death for that year?
Actually, historically, deaths have changed. The cause of deaths. Mm-hmm. At some point, it was mostly communicable diseases, but with the introduction of vaccines and antibiotics and all these things, that we have now seen a shift where now it's mostly chronic, non-communicable diseases, and that is globally.
Yeah.
And so with Belize, we are no exception. So when you look at the leading causes of death, for example, you'll find that heart diseases are the leading cause for us. Mm-hmm. You have cancers, you have diabetes-related deaths. So it's mostly NCDs. You still have things like HIV being in the top 10. Mm-hmm. You have other, what we would call injuries that also came in the top 10.
Yeah.
And injuries you have, we call it, you have self-inflicted injuries, which would be like suicides. Mm-hmm. You have intentional and non-intentional injuries. Intentional, you have homicides. Mm-hmm. Non-intentional injuries, you have like road crashes, you have drownings, and other injuries that might happen.
Okay. So we do have the chart up, and again, we're looking at 2018 data. So let's start off with the top killers. So we're looking at diseases of the heart. My first question was, how much of that data includes people who have defects maybe that they were born with, or is it just acquired diseases that people have?
Yeah, most persons, I must say, most persons, adults, if you look at who are dying of heart diseases, for example, the majority are the elderly.
Okay.
So when you look at congenital cardiac problems, you won't see much of that happening at this point. Probably would happen earlier.
Okay.
So when you look at diseases of the heart, these are more the elderly persons that are dying, and usually it's a lung chronic condition that they might have. Mm-hmm. If you look at the third cause, for example, diabetes, mm-hmm. One of the complications of diabetes would be heart disease. So you could see where these lead from one into the next.
Because I was going to ask that question. So something like diabetes can lead to cardiovascular disease. Mm-hmm. So where would that death be accounted?
Well, that's why we rely a lot on the physicians to diagnose the case, and so. Complications, as I said, of diabetes, you will have complications of diabetes. whether it be like amputations, and then these are also long-term effects on persons living with diabetes. Circulatory problems, if you look at, for example, number 7, cerebrovascular diseases, and you look at number 9, essential hypertension, though, these can, if you combine these, they can overlap.
Yeah.
Because cerebrovascular disease, for example, a stroke, can be a complication of circulation problems, of hypertension,
That's
of
right.
diabetes. So each of them are, they're affecting each other then.
I see the second one has malignant neoplasms. Does that speak to the cancers? or-
Cancers, that's referring to cancers. That is the second leading cause of death for 2018. And again, as I said, if you look at who all are dying of cancers and the types of cancers, it gives us some areas to that we can also look a little bit closer
So
at.
if we were to look at likelihood, so there's a higher chance that one were to die of a heart disease or of cancer as opposed to perhaps being shot and killed or being injured as a homicide.
Yes, if you look at it, yes, again, it's a lifestyle.
Yeah.
And then if you look at, we can disaggregate this data. I mean, you can look at data in different aspects. If you want to look at, for example, young people, men and women that are dying of what are they dying of? For example, if I look at the leading cause of death for, let's say, for women.
Okay.
For women, you find that they die mostly first of diabetes, the same setup that you saw there, diabetes, diseases of the heart, diabetes, cancers, they treat up.
So the same thing in a different order.
Right. For men, though, they die of diseases of the heart. The second cause is homicides.
Oh.
So you can see where, if you look closer, you get a different picture.
Yeah, yeah, absolutely.
What are the ages though, like an average age in terms of,
For
either of the, well, for the top 3?
Yeah.
okay, so who are dying?
Yeah. Who are the people who?
So if you look at deaths by age group, as I said, the elderly usually you would find that the elderly are dying of, sorry,
Go get you some water.
yes. I had a cough
Well,
problem.
I wanna get into that too because we're seeing some data about the flu as well. So you were saying that according to the ages, we're looking at what population or what age group are dying the most.
So if the elderly, definitely we should say, not say expect, but of the chronic diseases, these are long-term, they're dying. You have younger persons, as I said, for example, the cancer patients, the women, the leading cause of deaths, again, as I said, for cancers, are mostly, when you look at the leading cancers, for example, for women dying of breast and cervical cancer, these women are young women. You know, if you look at cancers in men, prostate cancer, it's more older, like 55 and over. So it varies on what is the leading cause of death in that group.
Yeah. It's pretty. You know, when you disaggregate the data and talk about male and female, and you see homicides popping up as the second leading cause of death for men. That is pretty interesting. That I think is. Should be a concern.
It's frightening.
Yes.
Thank you. Yeah.
Yeah.
And in fact, homicide is the fourth leading cause of death in 2018. Now, there's a significant gap between the heart diseases and homicides, but it still ranks fourth.
Yeah.
Yeah.
So
is this do you remember the trends in terms of how this has been going?
no, it does. I mean, when you look at the, for example, among men and the age group, so you find that the younger men are the ones that are in that age group of homicides, no? If you look at what your young people are dying of, for example, you have HIV, you have injuries, which is usually homicides, road crashes. And mostly when you look at, it's more male than females.
Yeah.
So it's a bit as I said, you can look at data on depending on the condition, or
Yeah.
you can look at data based on the age groups.
And so if we go down on the slide, there's actually a graph that shows that far more men die each year than women do. And that's just in looking at the different years, yeah. So it seems to be consistent that far more men are dying than women.
Yeah.
Yeah.
And again, as I said, when you look at the health-seeking behavior for men, men don't tend to look for health services until they're in some state of severe pain or very ill.
This is why I love graphics. But the one trend we do see is that the number for men seems to be basically the same, while for women it seems to be growing.
Yeah, there's a slight increase in the trend of deaths when you look at women. If you look at our population pyramid, it's always been like a one-to-one, female to male population pyramid. When you look at the deaths, it's a bit different. And so you find that it's like a 1.3 males to 1 female.
Okay.
So it's when you look at if men are dying more rapidly than women, you also have to look at the time that they're dying also, because men are dying younger than women. When you look at overall the data of deaths and looking at what are the chronic diseases, you find it's mostly affecting equally males and females. When you look at the injuries, these are more males than females. And when you look at the cancers, it's more females than males.
Yeah. Yeah.
So again, as I said, it's very interesting when you look at data, and you have to look at data from different angles, and so that you can appreciate why these things happen.
Which is why when we saw it, I thought, I think that being able to understand more about the data, because unintentional injuries, it's a pretty broad group that you have there, right? So that includes, if you said, it would include suicide.
That's intentional.
Oh, that's intentional. Okay, so where does that fall under?
Intentional. That's injuries, over injuries, but it's intentional.
Sorry, unintentional injuries includes crashes. Yeah, road crashes.
Right.
Okay, what else does that include?
Like drownings.
Okay.
You have, when you look at injuries on the job, you fall off or something. Yes.
Okay.
Type of things. Those are unintentional injuries.
Okay. So those would be, so that ranks at the 5th, because the road traffic data actually says that 79 fatalities were from crashes, right?
From 71 fatal accidents, incidents.
Yeah.
We don't refer to them as accidents anymore. They're incidents.
Yeah.
So, and then if you look at 4 of every 5 of those deaths were men.
Yeah.
When you look
That's alarming.
Yes, and most of them are pedestrians. If you look at the fatalities, 30% are pedestrians, which happens if you look at where the incidents are occurring. It's if you look at the roadways that are more fatal, you look at the George Price Highway,
The Hummingbird,
and the Philip Goldson Highway. But when we talk about that, it's mostly closer to the populated areas.
to the community.
Okay, because pedestrians that are walking on the roadsides.
Yeah.
I've done numerous stories on persons in the south, for instance, where you have villages along the southern highway, and persons are either walking late at night, they're either drunk on the road or that sort of stuff, and then they get knocked down and killed.
Yeah.
And I think for the most part, without having looked at the stats earlier, we take that for granted. That we just look at the fatalities based on road traffic incidents, as opposed to, cases where people are on the highway walking or riding bicycles and that sort of stuff.
And this is interesting, because I think that if we could go back to the map, Shan, just a little bit up more, this is where data is important in terms of being able to look at implementation of projects. So we have had projects here, which I think on the George Price Highway, which I would imagine led to this reduction. Right now we're focusing on Philip Goldson, which in 2018 had 7 and 5, which is 12. And then we see a very critical situation here with the hummingbird that clearly has to be addressed. And as you said, it's a lot of curves. It's also a lot of communities right on the roadside.
And an interesting change in the data that we have identified, and we were expecting it, was the motorcycle incidents. Because with the increase in use of motorcycles, you are finding now that we didn't have that amount of deaths related to motorcycle incidents before as we had last year.
So in terms of dying in a crash, it is most likely you'd be hit while walking on the road. Secondly, if you're on a motorcycle, that's the second group. And then there's even a differentiation between pickup and van versus car.
Yeah.
That's interesting.
Yeah. So if you look at, again, as I said, this data, you have to look at it a bit objectively because it relies on, we get our data mostly from police and our data, and of course the media, there's a process that we go in validating data. So we have to take all these data sources into effect to come up with some reports. But you know that when it comes to like driving under the influence is something that is very difficult to pinpoint if you don't have certain things in place. So when looking at injuries overall and the recommendations coming out from our unit in regards to the leading causes of death and especially when it comes to young people, looking at some of the measures, as you rightly put, with the, for example, with the George Price Highway, when it comes to having markers on the road, having a path for bicycles and pedestrians to walk, because you know in some highways there is no space.
Narrow,
It's no space for pedestrians and cyclists to be on. So everybody is on the same lane, and so the chances of ending in that type of situation is higher.
So in your line of work, you're looking at this data all the time. What stands out the most to you from the traffic fatalities?
Definitely the one with the motorcycles. I mean, we knew we were going to expect that when we saw the increase in the use of motorcycles. When prices of fuel go up, you know, people look at alternatives. And then you have all these motorcycles coming on board, on stream, on the road. So definitely, so that we have to look a bit closer at the data and see what the increase was. What else? Overall, as I said, when you look at, we are just in the process of establishing a cancer registry.
Okay.
We're almost there. So we should have some data at the earlier part of this year.
It still is voluntary? Registering?
Well, I don't think people have a problem with registering. It's the reporting part. It's the
No, I mean like with HIV, it's mandatory reporting. Like if I go into a clinic, you have to add into the system that I have HIV. But if I have cancer, I have to give approval, right?
Yes, and I think it's a bit easier because it's I think all the you know, the stigma attached to that is not as great as HIV. So it's easier, and then people are willing to share information if they're seeing something in return. So I think when you look at cancer's registration, we are in the process of establishing a cancer registry. I think everything is in place right now. We have collected some initial data, and so we should have some reports out of that tool very soon.
Let's move to suicides. I know it's an area where, for us in the media, we don't really cover suicides. However, there are numbers in terms of persons who, for whatever reason, end up taking their own lives. What are we looking at in terms of the figures for 2018?
If you look at just 2018, because if you look at it, it's 31 deaths happened for 2018. we try to look at trends over time and see where we're at. But overall, I think the data that we share are data that come to us that for people seeking services within the public health facilities. So suicides, our data is robust because it's based on death certificates. However, attempted suicides, are things that I think we underreport because it's only from whoever seeks services outside of the public health facilities. We do not have that data. But if you look at the persons that are committing suicides, again,
More males, 4 out of 5 again.
It's men. Okay, men attempt suicides 4 times more than women, and yes, and when it comes to attempted suicides, females attempt more suicides than males.
Men are more when men commit to do it, they complete it to the end.
They're
Women,
more, again, as I said, if you look at the methods that are used for committing suicides.
What is the, how would I say in a most politically correct manner here? What is the method of choice in terms of looking at how suicides are committed?
When you look at the actual committing suicides, it's mostly through hanging. I think if you look at hanging, probably is more accessible. People have more access to a rope or a strap or something to hang themselves. So that is the most common method that people use, and then that is followed by just overdosing with some medication or poison, and then of course gunshots.
I find the age group data interesting. Can you talk about that more?
Yeah. Again, as I said, we are. If you look at the rates. Because if you look at numbers, the young people are, you create programs for young people, but you have to look at the younger and the older people. Because if you look at the rates, for example, among the elderly, it's very high.
Over 50.
Yes. So it's very interesting. Again, as I said, you need more studies, I would call them more qualitative studies, to find out what really is happening within those age groups, why people are committing suicides.
So we have a spike here, which is 20 to 35, around 30, and then we have a spike over 50.
Yes.
I wasn't expecting to see that one.
Yeah, that is, again, as I said, it's a group that we don't normally discuss about, but they're a very interesting group. Again, as I said, people expect older people to die, but you don't expect them to die taking their own lives. But it's a natural process of the chronic conditions that they have been living with for all their lives. No?
See, now if we look at the age groups based on suicide attempts, that was more of what I would have envisioned, because that's where the younger population are attempting more.
And then again, as I said, the attempts are, again, it's mostly women, as I mentioned. And so, so it's the most younger age group. And at the epidemiology unit, when we look at the data, for example, it's, again, as I mentioned, it's only public health data, people seeking services within the health facility. So whatever the data you see here it's coming from the public health facilities.
I mean, a suicide attempt could very easily have been a suicide. So cumulatively, these numbers are very concerning.
And then an attempt usually is a predictor. An attempt. If you attempt it
again.
We do have data. We have looked at a little bit closer at the data in regards to people who attempted previously and how successful they are the second time or the third time that they go at it. So it would be good to have the data for all the attempts, so that whatever programs need to be put in place, you could look at that.
And just looking at the numbers here, Cayo at 34 attempts, Corozal at 27, and then Belize City at 24.
So if you look at...
so it's not necessarily population based.
No. No, it's, if you just look at numbers, no, you.
But Kaya has always stood out for us in the news as well too, because remember there was this whole emo movement among the young people there. So it has always been an area of focus when we're looking at suicides. I just never thought that Corozal district was up there as well.
Yeah.
You know.
And these are just attempts. These people survived the attempt. But this ties us into the mental health statistics that was also published. And I want to ask, because is this new data that is being compiled? Because it seems like mental health has really become a priority now.
Yeah, I think we had been collecting data. Nobody had really taken a closer look at the data as we are now. And so when you look at the leading diagnoses for mental health, for example, when you look at depression and anxiety, you know, it's, again, if you look at it, why, and if you even just look at people who are seeking the services, again, it's mostly females.
Just like regular healthcare, like physical healthcare.
Yes, no, but my point is that when you look at dealing with your mental health, men don't usually seek their services. If you look at
the numbers here.
Yes, for example, 723 females were diagnosed with anxiety, as compared to 267 men. So it's, again, as I said, when you look at mental health, there's still a lot of taboo. You know, mental health means you're crazy. Not necessarily that. Even though the Ministry of Health has psychiatric nurse practitioners in all health facilities, if you look at those seeking mental health services, the majority would be, again, as I said, referred from the general practitioner, identifying a problem with anxiety, depression, or persons being aware that that is a service and they would go and seek it out. But it's not something that people would walk in and get this. They would usually be referred. And so.
And this is only from public health. Because there are a number of private practitioners as well.
Yes. So this is just public health. Again, as I said, the data you're seeing today is just the Ministry of Health public facilities data.
How long does it take to validate these figures? Simply because I found it interesting you're saying that we're looking at 2018, which is, you know, 2 years removed, so to speak. And then there's still the figures for 2019 to be released somewhere in the near future, but that has to go through the entire validation process. How does that work, or how long does it take?
Yeah, it varies. Okay, we are, again, because that data is vital statistics, that takes a process. I mean, there's a established process within the unit. When you look at other conditions, for example, mental health, the HIV data, there are certain things that we have been working very closely along, that we have certain processes already in place that allows us to move quicker with those data. But we have a lot of new data. The cancer data, for example, as you rightly mentioned, we look at this part of mental health where we rely on the physicians to make a diagnosis. Then we have the mental health department who will take a look at the data also, you know, and then our statistical officers within the unit ensure that they're coded properly so that then we can do the analysis. So there's an entire process, that is entailed to ensure that the data that we present is valid. So what usually takes us longer is the death data. Definitely that and the births. Births, again, as I said, because you know, babies are born all over in this country,
and not all are registered.
Yes, and so we rely on the private facilities and other entities that do deliveries to report to us. And the only reason I think we get good birth data is because children are immunized, and then we provide immunizations.
That's one way of collecting the data on them.
Right. So so that kind of allows us, but again, the data might be a bit late. Until the babies are registered.
The process as to why you wouldn't start the year giving out the data from the year before is because you have to go in and vet and verify and collect
Yes,
all the
definitely.
data as the year comes to an end.
Yeah. So hopefully, again, as I said, coming up, we are working on the 2019 data right now. We started from before the end of 2019 with some data that you can already look at. And then so it's just establishing the processes of data cleaning and data validation process that has been in place. So now it's just running these figures and ensuring that we have good data to publish and to share with the general public. But these type of data is new. I mean, we're trying to get it more user friendly, so to speak.
No, the infographics are really helpful to people.
Rather than just have these lots of tables
or reports published.
So hopefully the general public finds this data more interesting.
I do have one question though. If we go back to mental health, so we had the top 5 diagnoses. There were anxiety first, depression second. The third was stress. I'm trying to figure out how do you explain that to people. I think everyone assumes they have stress. Why is that a diagnosis?
That you have to end up seeking some coping mechanisms.
Okay.
So people deal with stress differently. And some people can handle stress on their own. Some people it reaches to the point that you need to seek services for coping mechanisms. How do you cope with it? How do you? And so you find that people, it's not a mental health condition. You're just under a lot of stress, you know, and
you're
so
overwhelmed.
You're overwhelmed. So you go in and you are either through counseling or just being kind of exposed to different ways that you can cope with it.
And clearly, if you have excessive stress, it can lead to things like depression as well.
Exactly.
All right, so we are running out of time, and there's still more data to go through. Just asking, based on, because you've been with the ministry a long time, you've been looking at this data. Are there any major shifts that you want to point out that we are seeing in the 2018 data? Rise in trends, fall in trends?
We did not discuss HIV, but I really think I just want to highlight HIV. We had reached a point where I think we were plateauing. And I think we cannot let our guard down on HIV, because I think we are seeing again a slight increase in the numbers of newly diagnosed persons. And again, just remember that these are persons who test. We are still not testing everybody that we need to test. If you look at 35,000 tests were done
in 2018.
For 2018. 35,000 if you look at our entire population. And these are not persons, these are tests. So a person might test
so if I test twice for the year.
Yes, it's 2 tests already. And so, and who are the people that are coming out positive? If you look at, it's mostly males again are testing positive. It's the males who are dying of HIV. And so people are still dying of HIV at this point when there is, again, access to services, you know. So it's, I would really like to emphasize again that yes, while there are so many issues as in our own health, if we're dying from chronic diseases, and just know after the Christmas break, and you know everybody's pressure probably high, their sugar is high, cholesterol, everything is elevated. We also don't want to forget the other things that are killing our people, which again, as I said, are preventable deaths.
And we mustn't forget too that people also, because people take it so lightly, that people die from flus that lead to pneumonias. In fact, in the States, they are having a very aggressive flu season that's causing quite a bit of death.
And if you look at our, we do monitor influenza-like illnesses in the country, and we are in the season. Again, as I said, usually people that we look out for are the elderly and the children, because these are the people who are most affected by influenza. So yes, influenza can kill you, and for the elderly persons who are suffering from any chronic condition, where diabetes, cancers, the flu vaccine is there and it's free of cost at any public health facility. People should seek it out. A lot of people don't like it. They don't like to get their flu shots. But even though it does not mean it doesn't mean that you won't get it any at all. It's just that the intensity with which you get it will be minimal, no? So you might run it through quite quickly. It might not be so intense. So it does offer some level of protection. And so I would like to encourage those who have not gotten their flu shots, especially the people that we are targeting. As I said, the elderly, those with chronic condition, and the children.
All right. And while in 2018, 1,377 people died, we had over 7,000 births of new babies registered, right?
Yeah, if you look at the deaths, the average deaths per year is like 1,750. Average births probably per year is like 7,350.
Yeah.
We have a lot of babies.
More babies being born than there are persons dying.
So the population is still growing.
We have more baby boys born than baby girls. I never knew that.
So
nature works.
Yeah.
That's so they're dying, but they're also being born. More men are dying, but more baby boys are being born, at least for that particular year. So hopefully we keep our population at a balance there.
Yeah. All right. Well, thank you so much for coming in. It was a lot of data to be able to discuss, but clearly, not just seeing the numbers, it's also being able to understand the context behind it. So thank you so much for sharing the information.
Thank you.
We're going to go ahead, and this information is available on the Ministry of Health's website and also their Facebook page, so you can get it there if you want to check it out. We're going to go ahead and take a break. When we come back, we'll be talking to representatives of the Belize Book Industry Association, so stay tuned.